Hi John, thank you for taking the time out this evening to have a chat to me about your very recent treatments with me.
Nice to see you again, Dawn.
It's good to see you too, John. What, to your knowledge, was the problem?
I suffer with back problems because of my job, which is farming.
Okay.
And about Christmas time, I started getting a real problem with my back.
Mhm.
I've had physio, I've been to the doctors, and they are now recommending that I have surgery on it.
And how do you feel about that?
That would be the last resort.
Okay. So our game plan really is to avoid back surgery,
Absolutely.
if possible. And of course, as I explained to you, I do feel that it is very, very possible to avoid back surgery.
Yeah, absolutely.
So if we go back just a little tad, you've been a farmer, so therefore your working posture probably hasn't been fabulous.
No,
for
possibly
a long,
not.
Possibly not.
As we were discussing.
As we were discussing, because when you're driving, you have trained your left arm to be on the wheel and your right. Well, you've been looking over your shoulder on the right-hand side for the last years, one or two.
I don't like the cough, Dawn.
Well, go on.
Yeah, you're quite right.
You tell me how many years.
50 plus, I suppose.
50 plus years. So all of that, and the back then starts. So what we've done to date is that we did our first massage session, which I'd never massaged you before. You'd had treatments in the past, I understand.
Yes,
Okay, tell me about past
10
treatments.
sessions
10 sessions.
of physio.
And how did that help?
It didn't for the first 6. No effect whatsoever.
Right.
And then I had a different physio. And yes, it sort of helped for a day, but after that I was back to square one again.
Okay.
I'm on a health scheme, and the health scheme said that they wouldn't finance it anymore because if 10 sessions with a physio didn't work, then it wasn't going to work.
So they were just primarily looking at your lower back.
Yeah.
Did they look at your shoulder, your neck, your legs, or any hips or knees or anything else?
No, not to the extent that you've done it.
Okay.
I've got a problem with my left shoulder, which I didn't realise I had until Dawn came along and they gave me the works. No pain, no gain. I certainly had the pain, but I'm gaining.
You're gaining. Was it worth it?
Yeah, it was definitely worth it.
Okay. Tell me, so your shoulder was very tight and you didn't really realise?
Didn't really.
And now how has that improved after 2 sessions?
Yeah, very much better.
Have you noticed that improvement?
Absolutely.
How?
Because after the session when you told me that I had a problem with the shoulder, I realised that I did have a problem.
Okay.
And after the exercises which you've asked me to do, and after the sessions I've had with you, yes, it's very free. And the last session didn't hurt at all afterwards.
So basically, it's been 2 sessions. First one,
It hurt.
it hurt, but it was uncomfortable for
About 3 days.
about 3 days afterwards. And then when that discomfort went away, did you feel that did it just feel better, or did you actually feel that you had more movement? Had you gained?
I didn't really know, Dawn, to be honest. I guess that, yes, it was better because you had done something to it, and I didn't realise I had something wrong with it before anyway.
Okay.
But after you had pointed it out, yes, I could definitely tell the difference.
Okay. And when I saw you yesterday, in fact, you'd just come off the tractor and you were having a little bit of lower back issue then.
And also with my right knee.
And with your right knee.
Having been tractoring I was actually ploughing, and having been on there for probably 2.5 to 3 hours without stopping and getting out, when I went to get out, I had to actually stand up in the tractor cab to sort of release the right knee to be able to actually come out of the cab. And after the session last night, I've been ploughing again today, and I just got out of the seat, jumped out the tractor cab, no pain, no problem whatsoever. Couldn't believe it, to be honest.
So that is really good, because actually that's a turnaround of in actual treatment on the massage table time of about, we'll say, 2.5 hours. And yes, I know that I'd sent you a lot of stretches through, which actually you've been really good and you've been doing, so thank you. You've been trying, but I can tell that because I can tell from the freeing up, so I know that you're working with it, which is really cool. Have you noticed a difference with the stretches before and after? Have you stretched before, first of all? Did you used to stretch?
Yes, I was given some exercises when I went to the physio.
Okay.
But didn't seem to do any good.
Were they similar stretches to?
No, not at all. Not at all.
Okay.
Stretches which you have given me, which I've been trying to do to perfection, which I got several wrong, but you've corrected me on those.
Perfect.
But I'm surprised how quickly everything seems to ease. When I first started it, everything was very difficult. I had a job to get my legs up and one thing and another. And within a week, everything seems to be a lot freer.
So that's quite a turnaround.
It's brilliant.
So, would you recommend me, John, to anybody to help?
Now I hesitate.
That's a bit scary.
Yes, Dawn, I would recommend you.
Have I got a gun to your head?
No, you haven't at all. Not at all.
Did I offer to pay you?
No, not at all.
But seriously, do you think, I mean, being in the job that you do, I mean, having come from this area and known, you're a family friend, I've known you all my life, and I remember how you used to stand. We were discussing your posture, which actually I believe is the thing that's actually started your back issue, which we discussed and
we did indeed,
and could very well be. But also, sitting down, slumping over, you've got your paperwork. I don't know even if people realise farming used to be that you were out on the tractor. Nowadays there's so much paperwork, it's ridiculous. Mm-hmm. So not only is your posture in your tractor very important, it is also desk posture that's important.
Absolutely.
And have we looked at that at all?
We have.
So we've looked.
What did you tell me? Excuse me for interrupting.
Go on.
Computers. Number one enemy. And even my niece has a problem with her neck because she's on the computer with the farming invoices, etc. And she has now been advised by, I'm not quite sure whether it was you that told me and I told her, but she has now been and got a, what's the word?
Oh, the riser.
The riser.
That's the one that I said. Yeah, brilliant. Has that helped?
Apparently so.
Well, would you recommend me to your niece for a treatment?
Yes, I would.
Oh, that's good.
Yeah,
just double check.
Yeah, she's got a problem with her neck.
Well, there you go. I could probably fix her neck in one go. The truth is, crazy, but that's only posture, so that's fine. So if we go back to your farming, your posture, and your computer, you can see how as a sort of 50+ lifestyle, and bearing in mind, John, I'm sure as a child being on the farm, you were out lifting bales, carrying pails, milking, chasing cows, whatever, driving tractors. Probably, what age did you start?
11 or 12, I'd say.
So there you go. It's a long, it's a long time. And back then, they certainly didn't have the suspensions and the comfort. So you've had a long time of jarring on your back. And as we explained, the way that the back is functioning, etc., etc., what we need to do is stretch the whole back out and unkink it. And then once we've got into a good place with that, we can then follow up with more strengthening exercises, particularly to the abdomen. With the stretches, you've noticed that there are a greater improvement very quickly. Do you feel that it would be a lifestyle. I want to use the word achievement because I always feel that when people have stretches or something to do for themselves, that it's very easy to put that off and go and do something else, or trying to find 10 minutes to stretch in a day is incredibly difficult.
Yeah, but the only thing I can say to that, Dawn, is if you are suffering, you'll make time.
And it's worth it.
Absolutely.
Okie dokie. Are there any parts of your body that you are surprised that it's tense that you weren't expecting?
My left shoulder.
Yes.
My right knee.
Your right knee.
Basically, if I was an animal, I'd probably get put down, but
well,
hopefully Dawn is...
Luckily I didn't train as a vet. Wrong. Okay.
But not only that, Dawn, we've also had lots of discussions when you've been doing the therapy, and I believe that if I was in need of a counsellor, that you would be very helpful in that area as well. I can just tell that by the way that we actually talk. And I'm not afraid to talk to anyone. I'm certainly not afraid to talk to you. And you talk to me. So we've got a great, what's the word I want?
I think it's a trust relationship.
Yes,
it's open, but it's honest.
Absolutely, yeah.
And I think I don't want to put words into your mouth.
But it's not only because I know the family. We've known each other on and off for probably all our lives. That's got nothing to do with you being here and putting my back right. It was just a pure chance that we started talking, and you thought you would be able to help me. So that's why you were here.
Cool.
When we had the first session, you told me things about my body that I never even realised was wrong.
Was I right?
You were right, absolutely.
So tell me your feelings on your up-and-coming operation in October.
When I went to the doctor after the 10 sessions with the therapy, he said to me, there's no point in you going to see a surgeon unless you're prepared to have an operation. So he said, well, there's an 80% chance that it will clear you and there'll be no problems. So I questioned him and said, well, what about the other 20%? And he said, well, there could be problems, there could be after effects, one thing or another. So I thought that I would go ahead and see the surgeon to see what he had to say. I had to go and have some x-rays and
Scan.
I'm struggling here. A scan. No,
MRI?
MRI.
It was an MRI that I read, wasn't it?
Sorry, MRA, but it was
Yep.
MRI. So I had an MRI scan. I took that up with me to see the surgeon. He pointed out the problems, which to a surgeon was quite easy, but to me, a layman, I can plough a straight furrow, but when it comes to a crooked back, it looks all unnatural. But yeah, he reckoned that he could help me with surgery, and I agreed to it, and that's why I'm booked in for the end of October.
Right now, right here, right now, do you actually think you need surgery?
No, I don't.
I would agree, which is cool. So what we will do with John is we will continue with the stretching. There's going to be some exercises coming in when I feel you're relaxed enough and free enough to then uptake the job of starting to repair. So all the muscles will be in a great place, and then we're going to start to very, very gently reactivate them, remotivate them, and start to protect your lower back. And that basically means that we're going to have to work your core muscles, your abdomen. But of course, the one thing that I will remind you now is when you're on the tractor and when you are at the computer or when you are in a situation where you're seated, to remind you just to hold that tummy in, because your tummy is your airbag, your support to your spine.
So I guess I'm slouching at the moment.
It's very easy. It's all right. But it's very easy to go back into those posture. So that's the progression. And what we'll do is I certainly will see you once, at least once, possibly twice before you're due for your operation, and then you can update us to see how it's going.
Absolutely.
Look forward very much.
Yeah.
Thank you, John.